CMS estimates that approximately 1 in 4 adults, including 70% of Medicare beneficiaries, have 2 or more chronic conditions, which means they would all be appropriate for a chronic care management program. In this video, let's discuss what a chronic condition is and everything that it may entail. Hi, my name is Kathryn Anderton, and I am the Clinical Product Analyst here at ThoroughCare. I have a diverse background ranging from private practice to hospitals to care management. So you may be wondering, what constitutes as a chronic condition? A chronic condition is a condition that a patient is expected to have 12 months or longer. It also means that if a patient is not managing it, they can experience significant damage to their health. There are modifiable and non-modifiable risk factors that can contribute to a chronic condition. The modifiable risk factors include physical inactivity, unhealthy diet or lifestyle, and tobacco use. The non-modifiable risk factors can also compound these issues. These include age and genetic predisposition. Beyond the patient-specific risk factors, we also account for a litany of underlying socioeconomic, cultural, political, and environmental risk factors. While these have less of an impact than the modifiable and non-modifiable risk factors, they very much are risk factors that should be examined and considered. A chronic care management program can really improve your patient's confidence in how they manage their health. You are giving them the confidence to understand all of the information that they have received and ensuring they have the tools they need to be successful. So with that improved confidence, you are also empowering them to manage their health effectively. The benefits of a chronic care management program for a patient are vast. You can reduce the rates of readmission for a patient. You do this by ensuring patients understand that discharge paperwork, including understanding when they need to be calling their doctor versus going to an urgent care or ER. You're potentially reducing rates of medication errors, even by performing medication reconciliation. It's really important to have a full understanding of what chronic conditions a patient has, because if they are not managed effectively, it can increase their likelihood of developing more chronic conditions. So for example, if they're not doing a great job at managing their blood pressure, they're increasing their likelihood that they can have a stroke later on in life, or potentially increasing the likelihood of developing chronic kidney disease. So it's really important that when we've identified that one chronic condition, we take it seriously and educate it appropriately, including ensuring the patient understands their risks if they do not begin to manage this condition. If you'd like to learn more about chronic conditions or chronic care management, look at the description below. There's a link to the website, and we also encourage you to like and subscribe to follow for more.